First, we have to gather the equipments. Then, check the medication order against the original physician's order. Then, clarify any inconsistencies and check patient's chart for allergies. And then, know the actions, special nursing considerations, safe dose ranges, the purpose of administration, and the adverse effects of the medication to be administered. Then consider the appropriateness of the medication for the patient. Then perform hand hygiene. And then prepare medication for one patient at a time. Then next is to read the MAR for the proper medication for the patient's drawer. And then compare the label with the MAR. Check expiration dates. And perform calculation if necessary. And then when all the medications have been prepared, then recheck with the label with MAR, and before administering or before transferring to the patient's room. And then ensure that the patient receives the medication at the correct time. And then next is to transport the medication to the patient's bedside, and then keep the medication in sight at all times. Hello ma'am, good morning. May I know your name and your birthday for identification?
Princess Palacio, born on May 30, 2003.
Okay ma'am. So I am Jennifer Palacio, your student nurse for today, and I will be administering or applying a topical medication on your foot. Ma'am, okay lang po ba sa inyo? Okay po. Ma'am, do you have any allergies sa mga medications, sa mga drugs, ganun po?
Wala na.
Okay po. And then, next, perform hand hygiene. And then put on gloves. And then next is to wash, rinse, and dry the affected area with water and clean gauze. And then next is to change gloves and perform hand hygiene in between. Then place a required amount of medication using a tip applicator. And then apply using one stroke, and then observe inner to outer application. And then observe for signs of irritation and redness. And then after that, remove the pads. Then remove gloves. Then perform hand hygiene. And then document the procedure in the patient's chart.